Dr. Kevin Kavanagh is with us now. He is a retired physician and also the founder of a national organization called Health Watch USA. Dr. K, good morning, sir.
Good morning, Jack.
You got anything on what's going on in Europe?
Well, just as was said, it's being locked down in most areas. And I really do think we need to take a look at Europe and kind of adjust our behavior a little bit. They are being hit by variants over there and causing a lot of cases. CNBC had a very good article looking at vaccination rates, case rates, and you can then correlate that with lockdowns. Europe has a lower vaccination rate than we do, and they're having a resurgence. And a lot of these are with variants. And as we have discussed, we're very concerned that they may actually cause reinfections in people who have had COVID-19 by the wild type or the original virus last year. And so this is very concerning. But, and this is a big hopeful but, if you look at the United Kingdom, they have a vaccination rate of almost 45 individuals per 100. So we're not quite there, but we're vaccinating like you can't believe, trying to achieve that. The United Kingdom's cases of COVID are decreasing, and they're still going down, and they're talking about opening up or trying to lessen restrictions. And so that's what we need to do, Jack. We need to get vaccinated. And I know that a lot of my messaging is negative and people view it that way, but there's a huge out here. Get vaccinated. Because even with the variants, from what we know, the vaccine will keep you from getting severely sick, either in the hospital or dying, which I don't want to do. No one does. You want to avoid both of those things. And it will probably also help to decrease transmission of the virus. It doesn't mean you can't get it and can't spread it, but probably not as much as if you didn't have the vaccine. In other words, as a community, it'll tend to snuff out the pandemic. At least that's what I'm hoping for, but that looks like what's happening in England. I mean, the United Kingdom has a lot of dangerous variants. Of course, they have the UK variant, and then they have the new UK variant that has that mutation, the E484K mutation that can avoid some of the monoclonal antibody therapies and tends to avoid your immunity and cause reinfections. They have all of that, and yet their cases are going down because they are vaccinating themselves. And that is something we need to do. We really do need to encourage everybody to get vaccinations. And this is, regardless of your political belief, this virus is apolitical.
I agree. Anything new on the AstraZeneca product?
Well, yes, continuing to get more disturbing news. And as you know, I have not been very complimentary on AstraZeneca product on this show. And the latest is that NIH did not like the information which was submitted to them for review or approval. The information submitted didn't have a lot of quality data. In other words, it wasn't that it was bad, it was lacking, it wasn't there. We've also discussed how the AstraZeneca product did not perform well in South Africa, and that's where you have the variant with the E484K mutation. That mutation is in the Brazilian variant, it's in the New York variant. We're not sure about the California variant, but that has another similar spike mutation that avoids immunity. In fact, they've quit shipping a monoclonal antibody product to Arizona and California, presumably because it's not as effective over there with that variant. And so there are a lot of concerns. And if you remember early on during the clinical trials, this was the one where they said they made a mistake during the clinical trials, where the efficacy for some reason looked like it was greater in the portion of people who had the lower dosage of the vaccine, and that didn't make any sense at all. So to me, there's a lot of questions here. We don't need that product. We've got enough vaccines of the other product to vaccinate everybody in our nation and then some. And so I would stay the course with the vaccines that we have. In a lot of our areas of the nation, we are opening up vaccinations to literally everybody with the exception of children and some of the very high risk or individuals who we're not sure how that vaccine will work in. In other words, they haven't been tested yet. But in general, it is open. And I tell you, Jack, we're very lucky because I think we may vaccinate our way out of this. And when I say may, it doesn't mean whether or not the vaccines will work. It means whether or not people are going to be willing to take them. So let's get vaccinated.
All right. Always good to talk to you, Dr. Kevin Kavanagh. Thank you. And we will talk to you again on Friday.
All right. Thank you, Jack.